Top Med Talk.
Well, hello and welcome to Top Med Talk. We are coming to you live from the Windy City, Chicago, Illinois, for the annual meeting of the American Association of Nurse Anesthetists. I'm Desiree Chappell, your host, and normally I'm joined by my co-host Monty Mythen and Saul Aronson, but they couldn't make it this trip. We miss you guys, but this means I am flying solo, but no worries. We have a surprise guest host that's going to be joining me over the next couple of days, so stay tuned for that. Now, I'm also here representing Northstar Anesthesia as the Vice President of Clinical Quality for them, and want to thank them for the support of Top Med Talk to be here at the meeting. We are here in the exhibit hall on the Northstar booth, excited to be here, so we wanted to thank them for all the support. Now, it is day one of the exhibit hall here at the AANA, and things, as you can hear, are completely abuzz. Everyone is so excited to finally be in person, talking to each other, having some great conversations, long overdue. Now, for those of you that may not know, the AANA is the professional organization of certified registered nurse anesthetists here in the U.S., and we're going to talk more about that in just a minute. And I myself am a CRNA and excited to be here for the third year in a row, really, to have conversations with fantastic CRNA representatives from around the country. Now, I want to get right into it, and it is our privilege to introduce our guest today. We have the new president, incoming president of the AANA, Dr. Angie Mund, join us today. Angie, thank you so much for sitting down with us.
I am so excited to be here, Desiree. Thank you for the invitation to come and talk about topics that are so important to nurse anesthetists and healthcare, not just in the U.S., but globally.
Yeah, absolutely. Well, Angie, I wanted to congratulate you for your presidency. I think it was yesterday was your official start date, right?
You know, it's interesting at the meeting. Everything just all kind of flows into each other. Yeah. It really does, as we have half of our board continues, yes. New half coming on, smooth transitions. Yeah, well, good. Well, congratulations.
You know, no pressure, but it's like the weight of the entire organization now is all. I'm kidding. We also have the president-elect join us today, and he's a fan fave actually on Top Med Talk. He's been a regular guest of ours now, I think. Dr. Drew Riddle. Drew, thank you so much for sitting down with us once again here
Thanks.
On Top Med Talk.
Yeah, great. It's great to be here again. I appreciate the opportunity to come back.
Yeah, and congratulations as president-elect.
Thank you. Yeah, I'm excited. Angie and I have known each other for many, many years as colleagues and as friends, and it's really an opportunity. We've served on the board together for the last 2 years, and it's great to have that continuity and momentum that we're going to build, and bring forward. So, yeah, I'm looking forward to it.
Absolutely. Well, I want to take a couple minutes to get a little bit more of the background for you guys, because, there may be some listeners that may not be familiar with you and the work that you've done. So, Angie, please just start off by telling us just a little bit more about yourself.
So, I'm an Army veteran, which is a big passion for me. I was so fortunate to go to anesthesia school at the Minneapolis VA Medical Center, where not only was I a veteran, but a veteran taking care of veterans, which is so important. Served in the Army. I actually was down in Drew's neck of the woods in Texas is where I was stationed. I ended up being an educator, which I love. That's my other big passion. I'm currently a department chair down at the Medical University of South Carolina in Charleston. Nice. So I've gone from the veteran side, the VA side, academics, and now in leadership.
Wow, that's fantastic. And so the MUSC in Charleston, South Carolina, and
Correct.
You were the program director there for a little while?
I was the program director and recently got promoted to department chair.
Yes.
So the big advantage of that is not only am I leading a great group of nurse anesthesia program faculty, but I get the opportunity to do some really exciting interprofessional healthcare work with PAs and perfusionists and genetic counselors. And I think it's so important that they can hear what CRNAs do and what we bring to healthcare and what we as a team can do together. It's been fantastic.
I love that. Congratulations on your new role.
Your
other new role.
Thank you.
A lot going on for you right now.
Lots of good change.
Yeah, that's true. Drew, tell us a little bit more about yourself.
I've been a practicing CRNA for 22 years this year. I am in my non-AANA role faculty at Texas Christian University, TCU, in the School of Nurse Anesthesia in Fort Worth. Been there about 10 years. I do maintain a clinical practice. I'm a Northstar CRNA.
You are.
And was with Northstar from really kind of the inception of Northstar as an entity. I've been at that same Northstar facility for 17 years, and so it's great to have seen sort of the growth in that world as well. So the majority of my time is spent in didactic education. About 30 or 40% of my time is spent in research, and then 1 day of clinical practice a week. So I have kind of a cool opportunity to see a little bit of each slice of our kind of healthcare anesthesia continuum. Like Angie, I had the pleasure and honor of serving in the Army as well. I'm an Army veteran also, and had the opportunity to take care of our soldiers. I have never worked in a VA. I wish I had. I had an opportunity years ago, and I turned it down. And anyway, so. Yeah.
Oh, that's great. Well, Drew, I know on a couple of our conversations you talked a little bit about your experience with the Cochrane review. Just very briefly, can you just tell us about that?
Yeah, in my academic role, I'm co-chair of the Cochrane U.S. network. So Cochrane, for those listeners that are certainly in the UK, are very familiar. It's based in London. It's an international evidence-based practice and evidence-based organization, agnostic to any sort of medical discipline specificity, or it's across everything. And we have a reasonably newly established network in the U.S. of about 25 institutions. TCU is one of those institutions, and I have the opportunity to co-chair that entire network across the U.S.
Oh, okay, great. I knew we had talked about that before. I wanted to highlight it really quickly. I was telling you guys before, we have a lot of international listers, and there's a lot of conversation happening right now around the globe at previous meetings and things that I've been to over the last couple years about the role of alternative providers in the space of anesthesia and anesthesiology. Tell us a little bit more about the role of certified registered nurse anesthetists here in the U.S. And Angie, I'll start with you.
Yep, thank you for that question. The role is really everything from before you come in the hospital to after you leave. CRNAs handle meeting with you ahead of time, alleviating your fears of surgery, getting an extensive health history so that we can really tailor your anesthetic to your needs. We work as a member of a team with surgeons and with nurses in the operating room. And then afterwards, we want to make sure that you're comfortable and make sure that you're in a good spot to go home. So we do everything not from the beginning to the end. And we also take care of you from little itty-bitty tiny babies to over 100 years old and everything in between. We work in areas that include physicians' offices. We work in large academic healthcare centers, community centers. I'm from rural Minnesota. Rural healthcare is CRNAs only, making sure that our population in those areas have access to amazing CRNAs.
Yeah, that's fantastic. Drew, can you tell us a little bit more about the role of CRNAs in the world of academia? I know you come from that as well, and some of the other things that we're kind of involved in.
Sure. Yeah. So aside from being excellent clinicians, right? We're providers of anesthesia, and Angie, explained that so eloquently. CRNAs serve in all kinds of other capacities. We have nurse anesthetists that are hospital administrators, that are leaders in the corporate world of healthcare in the U.S. We have a fairly large cadre of CRNA researchers, not only anesthesia-specific topics, but other healthcare topics. We have nurse anesthetists that are elected officials and that serve at state and national levels on multiple different committees. So we have a unique opportunity as nurse anesthetists, not only to be excellent clinicians, but because, as Angie said, we see the entire continuum of perioperative care. We take care of all kinds of patients. We're not typically, pigeonholed is the right word, into one area or one aspect of anesthesia. We really have a lot to offer outside of just clinical care. And I say just clinical care because I don't mean it to be belittling of what the excellence of clinical care. So we have nurse anesthetists in the academic world, to answer your question, that serve as deans and provosts and chancellors of universities. And so it's a really exciting time to be part of nurse anesthesia.
Yeah, absolutely. Well, I just wanted to just very, very briefly touch on the role of nurse anesthetist in some countries. Yep. As we are starting to expand and other countries are looking at alternative providers, because I think this is a real opportunity for people to hear, where we might fit in. It may look very different in different areas, and I know we actually have an organization, IFNA, right, the International Federation of Nurse Anesthetists. Drew, I'm going to start with you and just tell us a little bit more about that.
So there are nurse anesthetists that practice all over the world. Angie and I both have had an opportunity to interact with our colleagues all over the world for years. And you're right, Desiree, it looks really different elsewhere. One of the pieces where folks struggle a bit internationally is finding a common curriculum to ensure that there's continuity in training for advanced practice nursing in the world of anesthesia. We're very fortunate in the U.S. that we have a very, very robust clinical, didactic training opportunities, university-based, accredited by a national accrediting organization. And so that does exist in some other countries, and quite frankly, others it doesn't. What's great about IFNA, our colleagues at the International Federation of Nurse Anesthetists, is they have established an international standard for advanced practice nursing in anesthesia. So it exists now, and there's a template and a model, and it's been well published and well referenced. So it exists now.
Yeah, fantastic. So that's something to look forward to, definitely, as we expand into other, possibly countries around the world. There are pathways for nurses to become anesthesia providers and clinicians there. So super exciting. We'll check that out for sure. Angie, I wanted to dive a little bit more into the AANA and hear more about the profession of nurse anesthesia and AANA as a professional organization. Could you tell us a little more about that?
So the AANA is the only professional organization that truly is for CRNAs only.
Yeah.
I take a look at their mission in several different ways. The first one is related to practice, is we want to make sure that our nurse anesthetists in the United States have the best information in order to deliver the best evidence-based care to the patients that we serve. And then we look at advocacy. We want to make sure that every patient who needs access to anesthesia care gets it. And we do that through legislative and regulatory activities. We do that through leadership. I'm glad Drew mentioned a lot of the leadership piece, because one of the things that the AANA is looking at is how do we develop leaders that can assume roles outside of the operating room. We need nurse leaders in academics. We need nurse leaders in the hospital systems. We need nurse leaders in the C-suite, let's be real.
Yeah.
That's really what we need to change practice. And we take a look at research.
Yeah.
How can we be a leader in practice standards that are really based on research? And then we look at membership. Is we want to be able to serve members in the best way possible, whether it's through education, whether it's through advocacy, so many different things. And lastly, I'm going to say, I'm so glad you brought up IFNA. That's something that's near and dear to both Drew and I, is really spreading the word of how we have nurses who provide anesthesia around the world, how we can use some of the resources that we have, because the U.S. was the first country to use nurses to provide anesthesia.
Yeah.
We have a long history, and there's so many ways I think that we can engage. And for anybody who's never been to an IFNA meeting, I can't say enough, it is the most energizing experience to meet people who want to do anesthesia around the world. Africa, I'm Norwegian, so I look at the ones coming from Scandinavian countries and our
I've met a couple
Asian
nurse
countries.
anesthetists from there recently.
It's amazing.
Yeah.
So the AANA has its hands in so many different things.
Yeah, fantastic. Well, let's focus in on clinical leadership, because I know that's something both of you are very passionate about. And I think here at Northstar, we are always looking for ways to promote CRNAs into different leadership roles and give them pathways to professionally, grow professionally in this space. What is the AANA doing right now to promote clinical leadership within our organization and outside of our organization?
It's actually an investment. It's a great question, and it's something that we have heard from our members, and I say we, the collective we, the board of directors over the last several years, that there is the need and desire to grow leadership. And the AANA actually is launching now and is continuing to roll out a really robust, evidence-based leadership development program. It's called AANA Ascend. It's powered by Korn Ferry. Korn Ferry, many of you have heard the name. They're an international organization group of consultants that provide all sorts of education and services. And we partnered, AANA, we have partnered with Korn Ferry to help develop a curriculum. The curriculum is sort of two-pronged. One is a curriculum for what we're calling volunteer leaders. These are CRNAs that perhaps want to serve in a committee or on a state or a national association. And then
within
the organization, okay, or perhaps within non-AANA organization, but more of the association space.
Yes.
The other piece being the career leaders, those that want and need a skill set, competencies to be able to lead in the clinical setting, to become a chief CRNA, a chief of anesthesia for a healthcare department or a system, to advance, as Angie said, into the C-suite, to perhaps go into other worlds in the U.S. context, reimbursers. We're looking for the big third-party reimbursement companies. So we have a really robust, we're excited actually, we're launching it today here in the exhibit hall, and so it should be ready for primetime consumption soon. Yeah,
well, the Vice President of Clinical Quality for Northstar, this is something that's near and dear to me because I feel like there are a lot of amazing CRNAs that we work with who, they may not want to become leaders, they may not want to become a chief, but they have a passion for quality or improving the quality of care that we deliver, or other things. And so I think this is fantastic that we have an opportunity for them to, and a pathway, I guess, for career development for them.
I think the other thing to consider with that, and I say this to my students every day, is CRNAs are leaders no matter what. At the head of the bed, we're leading the operating room. We're making sure that patients are safe. When things are happening that are fast, we're leading a team. So even if you're not moving up somewhere, having those leadership competencies in the operating room, I think is critical for patient safety.
Sure. Well, we all have a, I'm sorry, go.
No, I was saying, and that is so translatable to other leadership roles. You don't get much more critical, as we all know as practicing folks, you don't get much more critical in high-stakes decisions as you do at the point of care in the operating room at 2 o'clock in the morning with limited resources and a patient who's deteriorating. And so we have those skills. It's how do we take those skills and apply them differently to a different kind of decision making, a different way of thinking about problem solving. Because you're right, Angie, we are absolutely excellent problem solvers. We're good at prioritization. We're good at understanding and reading the room and knowing what's going on, assimilating mass amounts of information and making an immediate decision. But we don't always have to make decisions that way in a corporate boardroom. It's not typically life or death in the next 15 to 20 seconds, right? And so what I'm proud of on the AANA Ascend product is it starts with the fundamentals that these nurse anesthetists, these CRNAs, come in with that skill set. How do we build on it, and how do we change perhaps the way of thinking a little bit to be applicable in governance for an association or decision-making in a corporate boardroom. So to my knowledge, I think this is accurate, it's the only program specifically designed for CRNAs. There's plenty of leadership training and opportunities out there, but it's not really targeted to what do we come in with and where are the gaps that we perhaps need to make up to be good leaders outside of the operating room. Because you're right, we're absolutely leaders every day in the OR.
Yeah, I would say I always used to say that, whenever I was telling people, if you can step up and be a leader in the clinical space and whatever you're doing, that's who we are at our core. And I love how you guys said that, and, telling your students, that's who you are. You've come to the table. Now let's give you another set of tools in your toolbox that are very different, but they can help you grow professionally and within your career. So love that. I wanted to, touch on the fact that obviously coming out of COVID, it's been very tough times for all of us. And I know that AANA has been there and provided lots of support for our clinicians and for our organization. I just want to talk a little bit about what you're excited about now as we're kind of coming out of this cloud of COVID and these workforce challenges and things that we've been through.
It's interesting, as I was a program director as we were coming out of COVID, and we thought, everybody thought in healthcare that we were going to have decreased numbers of nurses applying for advanced practice roles.
I have to tell you, the case?
Not at all. We had more applicants through COVID than we've ever had. And I think this is the reason why, is there was much more visibility of CRNAs in the ICUs, and they really saw what we did and saw the full scope of practice that we can have, and that developed amazing interest in it. So our application numbers went way up where I'm at. And I've talked to other program directors, including Drew, is we're all in a good space for applicants. Visibility.
That's fantastic. Well, what are some of the things that you're most excited about as we go forward that, as we're now able to bring more clinicians, more students into our space? There's a lot of challenges that are associated with that, but what do you think, where do you really feel like we're going?
Excited about? Is that what your question was? Yeah. Being in person again, you can see it right here. Oh, yeah. You really can't you? As we're sitting there,
I haven't seen an exhibit hall like this in a long time.
I know.
Drew and I have been CRNAs for the same amount of time. And seeing all of our friends go by and how excited they are, they're loving stopping by the booth, and just that engagement is, I talk to students a lot, like Drew does too, And we have a family. I've got a family of 59,000 people. And this is a reunion. It's like coming to a reunion. You get opportunities to kind of catch up on what's happening with everybody personally, what's happening in their clinical environment or their academic environment, the networking. Absolutely my favorite thing of an in-person meeting.
Yeah, fantastic. Well, Drew, where do you think we're going as a whole, as a profession in the world of nurse anesthesia and in the broader specialty of anesthesia?
I think Angie hit the nail on the head. We had an opportunity to shine as certified registered nurse anesthetists during COVID. We worked as part of an incredibly collaborative team of healthcare folks. Physicians, nurses, respiratory therapists, pharmacists, frontline folks like paramedics and EMS folks. And we came through COVID, although it was a dark and scary time, much, much stronger as a profession. And what I mean by that is I think our healthcare systems saw the role of the CRNA as beyond just, again, using that term, just being at the head of the bed in the operating room, which is absolutely critically important. But the opportunity for us to flex and
extend, I feel like.
Extend and go. We're all registered nurses who had tremendous critical care nursing experience. You could not become a CRNA if you had not been an incredibly good ICU nurse. We're ICU nurses at heart, and we have the opportunity to help provide that kind of care beyond the excellence that we do in the operating room. So I think there's a lot of opportunity for hospital administrators, healthcare systems to understand how CRNAs can be utilized not just to fulfill their anesthesia needs, but maybe beyond that.
Yeah.
We're opening up into the world of chronic pain management. We're really lucky at TCU. We have one of a couple accredited fellowship programs in advanced pain management, and we're seeing that blossom. Patients are desperate for high-quality pain care that doesn't involve a prescription for some sort of addictive opioid. And so I think there's a lot of opportunity beyond the excellent clinical anesthesia care that we traditionally think of. Someone needs surgery, they need to go to sleep, they need pain control, they need to wake up. So I'm excited to sort of see what, as we come out of COVID and can bring our heads up and look around a little bit and say, gosh, CRNAs could be a solution there, or CRNAs could be a solution here. So we're already seeing that, and I think it's just going to continue to grow.
Yeah. Angie, any final parting words?
I've been a CRNA for a long time, and I have to tell you, it is the most amazing profession. It's one of the professions that you look about, like nursing, that you really can do anything. You can work at the bedside. You can move up into academics or leadership. You can work pretty much everywhere you want. Yeah. And I would say, too, as we collect data on this at the AANA, is the satisfaction of CRNAs with their decisions that they have made to be a CRNA. I would challenge that. I don't know if there's any other medical profession that has such a high degree of satisfaction.
Yeah, that's amazing. Drew, what about you? Any final thoughts?
I think this is a really exciting time to be in healthcare. It is an even more exciting time to be in anesthesia, and even more exciting to be in nurse anesthesia. I agree with Angie. We have probably the highest job satisfaction across all healthcare. People love our career. Those folks that choose to become nurse anesthetists, we love what we do. We love how we practice. And so, I'm excited to be a little part of that.
Well, guys, thank you so much for joining us today on Top Med Talk. Many more discussions to come that I think are going to be fantastic. I wanted to ask we have 2 seconds, one final question. We have a lot of SRNAs that listen to the podcast. They like to get information. We do a lot of, clinical translation, evidence into practice kind of stuff. Any thoughts or words of advice for SRNAs that are entering the profession here in the next several years?
Be involved.
Yeah.
I take a look at the mentorship that I've had through my engagement with the AANA and with state organizations. Yeah. You're going to find CRNAs that want to mentor you because it goes to satisfaction. We're so excited to be CRNAs. Yeah. Any of us are out there, and we want you to be successful.
Yeah. Drew, how about you?
I never lose sight of the fact that you are taking care of an individual at likely the most or one of the most vulnerable times in their entire life. And it may be the next patient in 10 for the day for you, but that moment of caring for that patient means everything to that patient and their family, and don't ever lose sight of that.
Yeah, fantastic.
That's great advice.
That is wonderful from both of you. Wonderful advice from our veteran CRNAs. I also want to thank you guys for your service so much. We always make sure to do that here on Top Med Talk. We appreciate everything that you've done for us and our country, so thank you very much.
Top Med Talk.
Be sure to listen to Top Med Talk. You know, you can always find us at topmedtalk.com, on the Top Med Talk app. We are there. We're on your favorite social media platform, Twitter, Facebook, LinkedIn. We're there as well. Be sure, if you like what you heard today, share with friends on any which platform you like. Drew, Angie, appreciate you guys taking the time. I know you're super busy during this meeting. Congratulations once again, and we'll talk to you soon.
Thank you so much, Desiree.
Cheers. Thanks so much for listening.